Athris Physio, he started at 2015. The first branch was at Sumatera. So we have total 5 branches now. So the BM one actually started at 2004. Okay, so before I start the main contact, so just a little bit of briefing what is physio. So I think if you all, some of you all been physio, some of you all still confusing what is physio. So to be clear, physio, how the physio words come is physical therapy. So physical, the definition of physical is we are not using any drugs and nothing to eat, and then we are not using any invasive. Invasive means I use knife to cut you open, so-called surgery. For physio, we don't do that. We only do physical. So what's meant by physical? So other than massage, normally massage is the pantai word for physio. If let's say you tell the physio, hey, you massage me, some new physio or some big physio with tempered one, he can see his face change already. So because we do more than massage. So we do like electrotherapy, we do tapping, exercise, some manuals, so-called, because from you all, from outside you look, oh, actually you are just touch. So for you all, you define that as a massage, but actually it's more than massage. We spend 5 to 6 years to learn that, so maybe in future, maybe I can explain a little bit more. That one is more technical. So for you all just need to understand what you need to do to get cured, to get pain-free. That's the goal. Okay, so a bit history. So the very first concept of physio is from Athris. So he is more on exercise. Actually, the first concept is more exercise. So actually, it started from exercise, not massage. Okay. So in this one is 1813, and then the Great Region 1894. There is 4 nurses. See, a lot is nurse. So what nurses do? Because that time actually quite near to the World War era. So a lot of in World War era, there was a lot of disease, a lot of illnesses happening. So what the nurses did is that they do tapping on the patient who having a lung disease, TB, tuberculosis. They do a lot of tapping, they do a lot of lungs percussions, and then they do a lot of positioning, and then they do a lot of sit the patient up, walk the patients, and then the nurse somehow they found out this one is actually works other than medications. So this one, why then they started to get more and more studies and get more and more involvement in physical things wise. So from there they set up a chartered or society of physiotherapy. And different corners, they have their own different history, but the main is this. Okay, and then for Malaysia, we do have an association. We call it MPA, Malaysia Physio Association. But that one is association. So what I think you all must be confused already, because I believe you all scroll a lot of Facebook, and then you will see some Mr. C is doing some manipulative technique. Okay, that one is not physio. Okay, that one I'm not convenient to expose his name, and then there is Julu, there is one center also they do these things. Jack. Okay. I don't know. But to be clear, that one is not physio. That's why physio, we don't have a doctor title in Malaysia, and then we don't have the master title also. Okay, so physio we do call ourselves master. And then what's the difference? Okay, physio we do more on a safe, evidence-based practice. So whichever treatment we produce, we doing for you all. If let's say it doesn't make you feel better, but at least I won't harm you more. That is our goal, our but I can't accept if your treatment is harmful. So that is our principle. So physio, maybe you feel, this physio do not improvement, but at least I'm not causing more pain. And then, if let's say I do the ingat things, some clients will feel the condition worse. And then, in fact, I was in hospital for a few years. I received some cases from there, so not to say. And then the cracking thing is not to say 100% is bad, but you have to find someone who is good. So who is the one who is good? Who is one who is professional to do this? Is chiropractor. So how to differentiate? When you enter the shop, you look at the SSN, you look at the license. Normally, chiropractor, physio, we have an HPC, or we call it like KKM. And then another more easy way to differentiate how physio and chiropractor, we wouldn't put life on our patient during treatment. That's the thing. Because KKM, Ministry of Health, we have a lot of act, we have a lot of laws, privacy. So normally we wouldn't allow to be post our treatment videos online to expose. And then at the same time, like we would give a fake hope to the audience, to the community. Because like if certain video you watch, I did watch, my client told me he was in the auntie, he came in with wheelchair, then after the crack he walked up. Okay. So why people saying like they are giving a fake hope? Because not everyone, maybe the treatment is true. I'm not claiming that saying his treatment is a restricted one, but not everyone is, because everyone has different injuries, everyone has different medical history. Some patients, they will feel like, after they watch the video, you can imagine how they think about the treatment. They will expect a lot. They will say, okay, I'm paying for 20 years. Finally, I saw someone can do within a minute, then I can walk out. He's bringing a lot of hope, and then when he go, it's not something, it's not like he's expected. You can imagine how disappointed he will be. So that's why for our physio, our medical ethics, we wouldn't tell you, you come to me, I confirm plus job, you can walk out like that. No. Normally what's our physio words favorable is like, it depends. Yes, it's true, because everyone has different history. Some of us, like, we eat vegetables, we eat every day, we eat different types of vegetables. Some people like me, I eat fried chicken every day. So how we can expect my recovery same and another person who is taking care of his diet is different. So actually, to look at the whole picture, you should be very responsible to be a physio. Because we can't give you fake hope. We can't give you fake promise unless I'm very confident. Maybe these cases, I have a lot of cases like that, I already used to it. I already know from the first session, from the second session itself, the recovery is there. So I can assume the recovery will be until which level, and then when will be the recovery stop. So that is a professional, and that is what physio can do. Okay, long story. Alright, so as I said, this is the role of physiotherapy. So you can see the very first thing is like reduce pain. Reduce pain, improve functions, movement functions. So which means you have to move. Everything has to move, because our human, God created us with 7 layers of 7 cervical, 12 thoracic, 5 lumbar with 5 fused toxic, and then multiple joints, multiple muscles. Which means these all things is like a mechanical. If let's say you are a very car person, you can see, okay, this car got 7 gears, got turbo engine, 1.5 liter, horsepower, 500 horsepower. So we will stop park your car inside your house only. No, you drive it. You drive every day. Same as human. We have so many joints, so many muscles. We are created to move, not sit. I mean, like for now you are sitting now, so because you have to be still to focus and listen what I'm saying. Okay, so and then restore mobility. So other than pain, some of our clients is disabled. Not like means like they are born with that, like such as a CP child, children child, and then some of them pain because of the stroke. So after stroke, physio will be teaching, guiding them how to move, how to walk, how to carry on for their rest of their life. Some of them might be recovered 80%, some of them might be recovered 50%, but at least they can carry on. They can eat themselves, they can bathe themselves. That's what we can do. And then improve posture. So what we're going to do later, improve posture, educate patient on ergonomics. Usually I teach you how to take care of your ergonomics. Ergonomics means the way you sit, the way you stand. Is it correct or is it suitable for you? Okay? So I think some of you all have this thinking. Some of my clients tell our grandparents last time worked at the guitar tree there. They got no pain also. Last time they used to go a lot agriculture. They do a lot of the field, everything, but they don't have so many problems as us having now. So yeah. Why is the younger generation experiencing so many musculoskeletal injuries today? Okay, for me, my youngest patients having neck pain. You guess how many years old? 8 years old. 8 years old itself telling me that having neck pain, cannot study. Not to say he is lazy to study, he is a very good student, but he having this problem. He can't focus because the neck is so soft, so big. But why is this happening? Because last time, 10 years back when I was still studying, normally my patient base is above 35, above 40. Most of them are at least, we call it a senior citizen. But now it's not. Now 8 years old to 80 years old, sometimes 80 years old, recovery is better than 8 years old. That's a trend happening now. So this is our grandparents' lifestyle last time. So you can look at the posture, how they read the newspaper, they lift up their arms, they lift up their heads, they lift up their shoulder, and then newspaper, every single 5 minutes, if let's say the eye is clear, 5 minutes, he will turn, he will move. Okay, so if let's say finish this newspaper, he will go reach another newspaper, he will read another newspaper, which means movement is happening, and then the posture is good. And then what happened now? Believe me or not, this is considered a better version already. There's even worse. I can see. Yeah. That's why it's not only happens to the elderly, the youngsters also. The way they say I can't find a word to describe also. Okay, so this is the reason that physio is getting more and more, and then the demand is getting more and more pain. And then we compare this is how our old days people works, and then you can see the movement. Farming and planting is about squatting, walking, lifting, carry on, bending, and then gardening, everything. But now the youngster, this one when you do this, you get paid, no? You get salary for doing this. But now people paying money to do this. That's why Hyrox, I think you all get know like what is Hyrox. A lot of youngsters, they are naked, and then they carry everything, so they run, and then they need to pay every session 200 again. So the era is changing. So we cannot because our daily activity is getting more and more still. We are not moving. That's why we need to find some activities to move ourselves. So if let's say you have budget, you need more motivation, then you take the gym. And if let's say you feel like I can do it myself, you are disciplined enough, you can find another way. You can do gardening as well, you can walk, you can go swimming. That one, everything is good for us. So this is how most of us working like that. So you can see a lot of difference already. Okay, so a bit technical. This one is the research. Like I said, whatever I tell you today, actually it's not like I'm the one saying. We are reference to the article studies. So the studies, they will like maybe carry on with some prof or with some doctors or with some physio, and then they will collect the data. And then from the data, only they can prove to say, oh, it's because of this the problem is happening. It's not like I'm just telling you like, oh, based on my experience, oh, everything has to be evidence-based. So this one is articles mentioning that actually our bodies get more easily inflamed if let's say we are static, we are sitting in a long duration, and then we are sitting in a bad posture. It's like that. Okay, so they have a scale to measure how bad is your posture by this. So you can see the marks is getting lesser when you are doing a lot of overhead movement. And then if let's say your movement, your posture, everything is a bit neutral, then the marks will be lesser. So which means if let's say this scale you have higher marks, you are higher risk to get injured. Okay, this is the neck. You can see a lot. The straight one will be +1. Then if let's say you tilted a little bit, +2. So number 3 is normally our usual one now because of the handful. Okay, +4. Some of you all maybe you ask, oh, how come got people +4 one? So where the question got? Some people they do a lot of lifting, like the one I have a client who is repairing aircon. They need to do this. And then you can see the step 10, the +4. This one, I have a client who is driving the crane, the import-export one. They will drive the crane to lift up the container. They will be climbing up to the crane and then stay upstairs the crane for 6 hours, and then they will be taking these +4 positions. That's why he's seeing me for 4 years. That one is due to the occupational hazard. That's why the company will be glad him to claim his physio expenses. So the company is expecting him having a weapon. It's unavoidable because the workplace setting is memang like that. There's no choice. Okay, and then this is the articles previously mentioned one, long-term static posture, which means you are not moving. Closely related to the occurrence of MSD. MSD means musculoskeletal disease. Okay? Long story short, I just skip. Okay, so static posture increases risk of musculoskeletal disorder. So which means you are not moving, you are sitting for long duration, you mostly having a neck pain, shoulder pain, upper back pain, and lower back pain. Actually, for me, it's the same. It's a one situation because the spine is neck, back, upper back, lower back. So the spine is to be short. So the neck and shoulder is neck and shoulder complaint is the most common one. So like just now, few of you all start asking me a lot of shoulders problem. So sometimes shoulder problem is came from neck. Maybe, but that one I can't really let you know by the first glance, or you just tell me, oh, I have shoulder pain and straight tell you neck problem. No, I have to do treatment, I have to do a clear assessment, then only I can find out. I can tell you whether is it maybe linked to your neck or not. But other than that, I should not tell you, I should not conclude you that saying your neck pain or shoulder pain is due to what. until I do a clear assessment of you. Okay? And then duration. Duration means like last time, that's another different from last time era and this day. Last time when we watch TV, we watch TVA, we watch MTV7. So what happens? One day only one episode. If you want to watch another episode, you have to wait for next day, 6 o'clock sharp. You have to finish your cook, then you sit there waiting the iklan, then you watch the TV. And then what happens? Every 15 minutes they have their commercial, they have iklan. And then what's my grandma used to do during iklan? She came out, refill the water, go for a walk, sit down, watch back. So last time you can see every 15 minutes, every 20 minutes, because of the commercial is very boring. And then they force themselves to move. But now, no. Netflix, TikTok, you can watch the whole thing. You can no need to sleep also. You burn your dinner. You can watch 28 episodes in one day. I don't know how. My mother maybe TV one, drama, and telephone one, table one. So that's how they learn, and then she's not moving on. Not to say my mother only lah, some of my clients. So it's very common really, because everyone is doing this. If let's say you are sometimes you're not doing this, you feel falling out. You feel my friend they watch the Netflix series already until the end already. I'm still watching the first. I have to rush, so I can put more common topics with them. So there's nothing that change now. Era is changing, so maybe that's why physio is getting more. Okay, and then static loading reduce recovery. Just now the static loading mentioning it may create injury. But this one, it will say reduce recovery. Believe me or not, our body every day is going through degeneration and regeneration. There is a balancing. So as you grow in, as you reach 30, 40, 50, your regeneration is lesser than degenerations. Then only you can say you are degenerating. Okay, so the static loading actually helps you, not only helps, is reducing your regeneration, which means your recovery will be slow. So a lot of people after injury, yes, you have to rest. There's a normally doctor will say, okay, I'm having shoulder pain. Some old school doctor will tell you, don't move your shoulder, rest. But until when? Because you are not moving, because you are staying in static position, the things you getting stiff, and then when you move, it's even create more pain. So the newer study actually is implement like some very severe injury unless you fracture or you tear your ligaments or your tendon. Other than that, you should move, but your movement should be according to your pain free, according to your range. Maybe some there is a research that I can only move like that. So you move like that and you move slowly every day. And then if let's say you feel getting better, then you push yourself a little bit a day. So that's will help your recovery. Compare to be just staying like that. Below improvement at all. And then so why does this happen? Why if you let's say you are not moving and then you are in a very bad posture, why injury happens just magically? Because you're not last time the injuries normally happens after accident. You fall, you crash, or you hit something. But now it's like I'm doing nothing, I'm just sitting there. Injury happens already. Why? Because muscle fatigue. Why muscle fatigue? Because you are in a very bad posture, you are doing this. So when you're doing this, your muscle is the one pulling you back to prevent you go like that. So actually you're not feeling your muscle is moving, but So that's a problem. And then reduce circulations. Why reduce circulations? I believe some of you all have neck numbness after long hours sitting. Why? Because the circulations. Why the circulation is reducing? Because you're pressing it. The blood vessels actually in between your muscles, and then normally it's at the back. So when you're sitting for long duration, you're not moving, you're pressing the point. Okay? So increase mechanical stress. So the mechanical stress I will explain, like I think you all saw a car, let's say an abandoned car, they park at the same place for after 6 months, 7 months, you can see the tire puncture, is it? But if let's say some of you all like didn't jaga tire, if you drive a car without pumping the tire, will the tire puncture or not? No. Maybe you become flat. Maybe the rubber is not in a good condition, but it would puncture, like if you stay there. So which means when you stay, the press is more, the stress is more. Okay, so what is the solution? So is it clear? We discuss. No, just joking. So movement, like I said, the more you move in a correct way, in a proper way, the better you are. And then it's quite, we 30 minutes and make it faster, and then we go for exercise session. If some of you all start Okay, so frequent movement. So every 30 minutes we take a break. Because I think some of you are already retired, so you have more options. Even watching a very interesting drama, I believe a 5 minutes break will make you fall behind so much. So you still can finish your drama, you still can finish your Netflix, no problem. But every 20-30 minutes, put the timer, make it as steady. Getting up from the chair, move a bit. And then this one, I think, you just skip this one. This is a cervical, your neck. Like 7 vertebra for your neck, 5 for your lumbar here. 5. In between, we call it thoracic, or we call it chest. That's 12. This one just a little bit technical. So what physio do? Okay. That's why you can see I'm not putting massage on my first. Okay. Hot bag, ice bag. That one is for your reduce your inflammation or make your soft tissue softer. The manual therapy, so-called massage, in easy way lah. And then electrotherapy and dry needling. Something like acupuncture, but we are not targeting the meridian point. We are like more on the Western medicine, we are targeting the anatomy. And then cupping almost same with the Chinese medicine one. But since we are not applying the meridian point. And then machine tractions. Okay, some of you all, I think you went through some doctor telling you, oh, your neck, the disc is a bit heavy, you're compressing your nerve. So what you can do, we have a machine, gently pull your neck to decompress it. Okay, exercise, postural correction. So yeah, allow me to do some marketing. This is my shop, and then we have few branches, but the nearest to here one is BF, opposite the what we call Fresh Record. Or you can search the Taman Terminal, Pusat Perdagangan Terminal. Okay, so anything, my phone is there, so this one is the WhatsApp lah. Maybe you can ask about like us what is our solution for your condition. But usually I advise you come to meet us in person before or after you arrange an appointment for us, then we can have a very detailed check on you. So per session only 1 hour. Okay, so this is 5 of our branches. We have 2 in Sungai Petani, 1 opposite Belu Plaza, and then 1 in Damansara, and 1 in BM. That one is where I stay. Okay, so now is the exercise. Okay. So exercise, my colleague will be around, and then maybe they will correct you a little bit here and there. Because the previous session I went to Dell, the factory, I saw like some of them doing very weird exercise in front of me. So at the same time I couldn't correct them one by one because I got limited time. Okay, so we will start now. So we will start with neck exercise first. So the first one will be the new one. So in between our elbows, the middle one, to press there, actually there's a heart. We call it spinal process. So what I want you to do is I want you to repeat. If let's say we do it one side first, you use your left hand, bring to the right side, and then you turn slowly towards your right, and then when you feel hold at the point of you feeling having some tightness, not to push it up, you just push until you feel tightness, and then you hold, breathe in, breathe out, breathe in, breathe out, so you back to the middle. And then again, so you repeat 7 times. The second one, so when you turn, you pull a little bit. And then you realize maybe some people are sitting at the front, his head is a little bit more mobile, you can see his nose now. Okay, hold it 1, 2, 3, 4, 5, relax. Okay. I give my colleagues sometimes very well. And anyone don't understand? This will do 7 repetitions. Yes. So this is the exercise where, why I start with this? Because the rotation actually is the upper cervical. So if let's say you are having a condition like headache, sometimes you're having like, you feel the neck is pulling towards your head. Yes, you can do this. This one is like, open up a little bit, mobilize your neck a little bit at the upper cervical. So the principle of this exercise is when you do, you should not feel pain. No. It's not like a DCM. Some people will have misconception. They will feel like, oh, when I do something, you must feel pain one. No, you shouldn't feel pain, and then you should do gently. You don't do like, pop. Then you tell me you heard some sound. No, you do it just very gentle, and then you repeat. So 7 is a lucky number. So you just push 1, 2. Okay? So just now we were doing left, now we do the right side. So same thing, in between the earlobes, we go find the heart surface, we hold it, then we turn. Okay? Going back to the neutral and then we turn. So everyone got it? So this exercise, it will take only 5 minutes, I believe. So some of you all, when you're feeling like, wow, a bit neck stiff, very hard to turn, you can do this. It just takes 5 minutes. You can do it every day. If let's say you're having pain or having very bad stiffness, you can do it every hours also, no problem. You got no harm to do that. As well as you follow the principle, there's 2 principles, no pain and don't do fast one. Okay? You can put hop back before you do this exercise. Hop back is very good. But let me explain a bit. Yes, that's what I want to explain a bit. Okay, so when to use hop back, when do you use ice back? To be easy to understand, hop back when you feel soreness, swing, and then you use hop back. Why? Because hop back you reduce it will loosen your muscles. It's like how when your meat is frozen, you put hot and it becomes soft. But same thing, you cannot put too hot and become masak already. Okay, you have to put warm lah. If let's say you have a thermometer, you put suppose around 65 degree to 50 degree is good enough, 50, and then 10 minutes. So sui put contact soreness like sengai like that, cekak. Electric one, the advantage is it will remain the temperature, it will go down. But the disadvantage, if let's say you step off, the whole night the hot will be there and then you might get burnt. Unless you are very disciplined, or you put a timer, you connect the timer so it will automatically, you auto switch off like every 15 minutes or 10 minutes. So the next one, when you use ice. So ice is like, if let's say there's an incident, someone hit you, someone slapped you, sudden impact, and then you feel like it's getting swollen. You can feel a hot, when you touch the area, it's like it's very sharp, and then the pain score is very high. Then you use ice pack. So why ice pack? Because ice pack reduce the gut, reduce the inflammation. That's why you see like some cases, accident, fracture, put ice not hot. Because if you put hot pack, the inflammation is more, and then the place injured is getting the gut will be very big one. The edema will be obvious. Yeah, because maybe your case is more inflammation, then they put ice. And if let's say your case is like because of the muscle stiffness, then they put hot. There is a standardized one. But Chinese medicine, they believe differently. Chinese medicine, they will oppose us to use ice to tell you everything hot. Okay, so just now the exercise is for the legal. And then another one is for the lifting. So what you can do is later I need someone hold the mic for me. Okay, so for the neck extension and the lifting, it one actually happens lower. So you can put lower a little bit. In between the earlobes just now was a bit higher. Then you maybe go 1 cm lower, and then you press the center of the neck, and then the press direction should be towards your eye. And then you go up slowly, and then down. So same principle, shouldn't cause any pain, and then you don't do it quickly. So this one you do with hand is a bit tiring. So what you can replace is you can use your towel. You just use your towel roll, you put between your leg, and then you pull towards your eye, and then you go up. So the repetition still the same, 7 repetitions, and then you can do every hour. So this one is for those. Just now one of the brother telling me she's having some neck problem. That one is very suitable for you. I forgot which. Yeah. So if let's say this one you do, it will help you to move up and down. So the same thing, same direction, holding the same spot. Just now you're doing lifting up. You can do the same thing, but you pressing down. So how you feel? You feel more relaxed right after the exercise. So this one actually is just a very general one. But some conditions, if let's say you're having very bad injuries for the neck, you might feel like after you do exercise, you're like nothing much different. At that point, you have to go see for physio or or you have to go check your MRI or X-ray. Sometimes, if let's say you have bolster, this exercise might not be for you. But some people will feel that after even they have very bad qi, very bad bolster, they do this exercise, they feel some relief. Okay, so this is the second exercise. If let's say you're having pain and then if you feel your neck is discomfort, you can do every hour. But if let's say you feel like, okay, my neck was fine, but sometimes on and off I feel a little bit soreness, then you can do like maybe like morning once, afternoon once, dinner once. Yeah, you can do according to your free time. Because this exercise has no harm one. It won't be like a person like, oh, I do overdose already. No, exercise you won't be overdose. But you must follow because 7 repetitions, I do go 100 lah. You can say you go 100, yes. Normally beginners we will suggest doing sitting because you can see when I stand, if let's say I'm having back problem, when I stand and some of the clients they do exercise like this. You can see the difference or not? When they do, the neck, suppose the neck movement only, but the back kimochi a bit came out also. It's not your fault, or it's not the patient fault, it's normal because if let's say you're having a neck pain, very serious hip neck, your body will help you to do this because your body think you need to do this, and then he will compensate everything to do this. You do this. But actually the neck is supposed to move, not the back. So in sitting, you will rule out this problem. So when you do neck, your back is fully supported. Okay, so we go for the last exercise. We move out of the neck, we go for the shoulder. It's not a very easy one, but you feel more relief. Okay, so maybe you all space out a bit. So the hand, just open your hand widely. It comes on the leg. Okay, so you push your neck, your shoulder backwards, like to squeezing your shoulder blades. Sitting in sitting position, and then you turn your thumbs backwards, and then you squeeze down. Some of you might have some crack. But same thing, you don't thumb it very hard, you just like a very gentle rubber band, you just scratch it, and then you push down. Yeah, you can do it instantly, you can do it sitting. Yeah, so a lot. Why I prescribe this exercise? Because now very common people doing this. So I want you to open up. Okay, so same thing. You can do 7 seconds. You can do every hour. Jantung, yeah, that one might be the reference point of your heart. Sometimes it's not. This one is most of the musculoskeletal problem. It's because of your spine, because of your muscle. So sometimes some heart disease patient, they will have the same types of pain, but actually the key problem is not because of muscle, it's because of the heart. So maybe the medicines, the histamine, all the medicines they eat, the dose is wrong. So that one, the patient have to go follow up with the doctors. Maybe you have the other cardiologist, you're having this kind of rapid pain. So see what he will. Normally he will adjust your dose, or else we will go another checkup to see whether the block is getting worse. But for heart disease, there is a red flag. Let's say you start feeling numb over your left. numbness is a very dangerous sign. So if let's say pain, sometimes if any pain here or the back shoulder blade, sometimes not necessarily heart, sometimes the stomach. So there will be sometimes like maybe you forgot your lunch or you eat something very spicy, you might have this pain. Yeah, so the problem will be resolved if let's say you drink more water, plain water, or you reduce your spiciness, your food. You eat something more soupy or less spicy. It should be helped. If let's say don't drag for a few minutes, then immediately go for checking out doctors. Because heart is very critical organs. It's very dangerous. If let's say it's getting good, then no problem. Okay. Wing is the stomach. It happens, sometimes it happens, sometimes it happens. Because our stomach is this here. This is our rib cage. The stomach is in. This is our umbilicus, our tongzai. Stomach lay in between the rib and the tongzai there. So sometimes if let's say you're having bloated stomach, you imagine it's pulling your diaphragm is your breathing muscles. So when this happens, you tend to breathe using your neck. Yeah. So actually, if let's say you learn from and everything links actually. If let's say for those people doing meditation, they will be like relax all the muscles and then they will focus the breathing, taking out through the stomach. But some people when the beginners try to meditate, you can see the shoulder is moving. The entry inside the stomach is less because of the tightness. So if let's say he's trying to meditate, trying to do yoga, do a lot of stretching, things will get better because these muscles, actually this breathing technique can be trained. So no worries. Yes?
As we age, we tend to sit more, relax more, and do a lot more. So what is actually the effect inside? Is it a muscle or blood flow? Both of them?
Very good question. You mean like when you sit more, you feel pain or like
We tend to sit more. And then we forgot. So I think we go to the exercise, then the after effects come in.
What you mean the soreness? The after effect of
Like
after
some more lazy and so on.
Okay. That one is very big things. Okay. So understanding of what is degeneration. So like I said just now, the regeneration is getting slower, the degeneration, the breaking off is getting faster, the building is getting slower. So at the same time, your body, the absorption of the water, the nutrition is getting lesser. That's why you feel easily like I feel tired. I want to go have a nap, and maybe nap at 2 o'clock wake up at 6 a.m. Okay, so that is a sign of your body. Maybe you are like a water, but that one you have to do your blood check and everything. So maybe your lack of exercise. Some people they feel like lazy to exercise, but if let's say you push yourself to exercise a bit, not too hard, not until you feel like breathless, but you just maintain it as a routine. You stick it 1 week and then you observe. Actually, the laziness you get lesser because your body, your muscle is like a thing like you use it or you lose it. If let's say you are not using, then you will break down, you will convert to fat. Okay. So actually what you need to do is you have to fix a routine, just maintain that routine. But your routine is supposed to be achievable. You not go like set the target, okay, I want to walk there now today. Then walk. Day one, then always day one only, you know more than 2 already. So you make it like every day something is very small and a little bit challenging, but you're able to complete every day. And then you observe the changes. Your lifestyle will be different. Yeah. So for you, if let's say you feel tired easily, sometimes your breathing, you have to slow down your rhythm of your breathing. Tiredness sometimes is reduced oxygen, which means your breathing technique is wrong or you are dehydrated. Because as we age, our body absorb water is lesser. So actually you have to increase a little bit of your drinking. Drinking plain water. Soup is not considered water. Juice is not considered water. Coffee is something worse than water. Coffee is good if let's say you drink every day in a certain amount of dose, because you boost your metabolism. You feel more energetic. You will feel more easy to go around. But if let's say if you drink coffee without drinking water, then your body will dehydrate faster, because coffee will dehydrate you. So if let's say you want to drink coffee, you drink more water. Yeah, to replace it back. So there is a formula to calculate, but we don't need to stick until the professional, because we're not bodybuilder. So if let's say your body weight is around 50 kg, 60 kg, so maybe you can drink 2 to 3 liters. If let's say you are more, then maybe you have to keep more water, because your body, the surface of your body is bigger, and then you consume more water. Yeah. Okay. So, any questions on the ground? Okay, so the exercise you can remember. I saw some of you all take some videos. So if let's say you forget, you want the free version, you will take the video from her, and you want the paid version, you come to find me out. Okay, just joking. Yes. Sorry? Yes. Yeah, because sometimes if you walk in, sometimes I scared and we engage with patient, then I scared they have to wait for it's better appointment, so the whole hour will be lost. Yeah. So just kidding, like they must find me lah. Actually, because BM is a lot of physio centers, so you just go wherever it's convenient for you. Because physio is not like magic. Then you get cured, no, maybe you have to follow up for few sessions. So the more convenient for you to reach to the physio, the higher chances you get cured. Because if let's say you go somewhere far, morning 9 o'clock itself you're thinking to cancel the appointment already. Because lazy. So to entice, like overcome this, you go somewhere near to you, somewhere to convenient for you lah. Yeah. So okay. So yeah, no problem. You mean the exercise? For me, I would advise that you start the exercise empty stomach also no problem. Because when you sometimes elderly, after you eat you feel tired already. And then there is a lot of studies mentioning when you finish your food, the blood flow will be focused more on your stomach. So you can do very light exercise like a slow walk, but you shouldn't do something very aggressive. So it's for morning session and exercise, normally I would advise the first thing you do, wake up, drink warm water first. And then you do your stretching, you do your exercise, you'll be better. Because when you sleep for 8 hours or 6 hours, your body is really dehydrated. So the first thing, hydrate yourself first, and then you do the exercise. Without pain, slowly. Okay? That's the easy part. Alright?
For a normal physiotherapy in your case, do you need a orthopedic report or
it depends on your condition. Let's say you're having very bad situations.
There's a long injury.
Then maybe if let's say you have a report, you can give us, you can have a reference on that. Then if let's say some of our clients, they came to us first before they go to doctor, so we will assess on the spot, we will do the physical examination. If let's say we can rule out the dangerous things, we'll proceed to treatment. If let's say condition get better, then we go for doctor. If let's say something is very severe, because some of my clients, they came in with wheelchair and they not able can stand up. Normally, we will take the treatment also. We will advise them to go for the emergency
So
scan.
mobility is there. It's slow.
Slow, no problem. Slow, no problem. And then someone, if let's say you have history, that one history, long history, so we can take it as a reference. But still, we will do a short assessment, so we just can get know what is we can a little bit like go near to your problem. We will know how to analyze and what is the causes of your problem. No problem. Okay. Any question? Alright, so thanks Ms. Yap having us here. And I think for the 3 exercise you will try first. And I hope you all get pain free and then happy mobile life. Have to move. That's my words, have to move. Don't sit.